In Module 6, we're going to investigate sinus bradycardia. Revisiting our earlier lesson on Life-Pak 15 and modules, you'll notice that we already have our 4 leads, our limb leads, attached to a cardiac rhythm generator, as well as our 12-lead hookup has already been placed. We'll initiate the monitor by turning it on. We'll wait for it to self-test. And in the mornings on startup, we'll begin by doing our daily check options. User test. As the Life-Pak 15 goes through its daily user test, you'll also note the condition of the equipment for every test. So in bradycardia, it's important to recognize and make sure that the lead placement is correct. And of course it's correct here. We can refer to Module 2 for cardiac lead placement, 12 lead placement, electrode placement. We have our rhythm generator on, and we have Sinus Brady generated on the screen. You'll notice on the Life-Pak 15 monitor, in the upper left hand corner where the heart rate is displayed, the rate is a rate of 33. And as for the rolling rhythm strip, you'll notice that it is pacing roughly at the same rate. Once the BLS provider notes a heart rate of 33 with a sinus rhythm, they will continue to go ahead, even though they see 33, they will notify ALS for upgrade, and then continue to generate a 12 lead prior to ALS arrival. 12 lead generation, enter patient's age, sex, male, female, and the Life-Pak 15 will generate a 12 lead rhythm strip. So at this point we've placed our electrodes and we've noticed a heart rate of 33 per our Maryland medical protocol. This is defined as sinus bradycardia. We've called for the upgrade. In the meantime, we've generated 12 lead for the ALS provider when they arrive. We can verify our diagnosis of sinus bradycardia by looking at our 12 lead and using our squares, as in our earlier lessons, to measure the distance from the QRS complex to QRS complex. In this 12 lead, we note that the QRS complexes are consistent in all leads V1 through V6 with a consistently shaped T wave. We also note at the top, Life-Pak 15 has generated 12 lead, the number 12 lead, which number 12 lead it is, as well as is giving us an unconfirmed normal EKG stating unconfirmed diagnosis of sinus bradycardia. So the BLS provider has called for an upgrade, an ALS upgrade, as well as diagnosed sinus bradycardia on the 12 lead, prepared a 12 lead for the ALS provider, and has a monitor hooked up ready to go. At this point, the BLS provider will continue to use his Maryland medical protocol, attach the blood pressure cuff, and get a normal set of vitals.